Our table talked about adults needing to upgrade for basic skills as far as ABE and GED. And the first question that we addressed was, what are the implications of our community's changing demographics and labor market trends for our populations? We had a pretty robust discussion, and organizations represented at the table were City of Austin, the Literacy Coalition, Goodwill, River City Hope Street, which is a faith-based organization, the Internal Revenue Service, and Workforce Solutions. With the increased population in Austin, and we heard earlier approximately 140 residents moving a day, the implication for our population is it's making it a greater disparity between the have and the have-nots, or the term that you hear now is the tale of two Austins. You've got a very educated population that's coming for the high-skilled jobs, but we see more and more residents who are bringing themselves and their families to Austin for this economic opportunity who don't have the skills. So it's putting more pressure on our agencies to do the work. We also talked a lot about another topic Ken has addressed in the past, and that's suburban poverty. We've gone from most folks who are on the lower socioeconomic level in the city to many of them being around Austin. So what does that do? You have to deal with transportation and affordability issues. A lot of the companies that are moving here, even for lower level jobs, are in the outer areas. So transportation is a big issue, and it's not just traffic getting in and out, but instead of having to get into downtown, if you're in South Austin and you're looking at opportunities perhaps in North Austin or Round Rock, and it's public transportation, that's a problem. So we talked a lot about that. Educational investment, you heard earlier from Meg Pogue that Texas is 49th out of 50 states when it comes to adult basic education funding. So there needs to be more advocacy. Some kind of way we've got to find a way for our legislators and others in the industry to know the importance of this. And finally, we talked about social services and the connection to the business community. There are a number of providers here. What we need more of are business owners and managers that are part of this conversation, so we can let them know that our services are delivered to help their bottom line. When it comes to our economy, it's about return on investment. And we need more investment in our agencies so that our clients can add to the bottom lines of companies. So
when talking, we spoke about the different barriers that there is out there, but even before that, we spoke about the two Austins and how that impacts people without the correct documents, how it excludes them from education or work. When one of the presenters showed the basketball court, and it showed if you didn't have the right education, you were like basically at the other side of the basketball court. In our case, you're not nowhere near that basketball court if you do not have the right documents. We also spoke about the systematic changes, and with that we spoke about safety in our communities and what safety meant. Safety meant different things for everybody on this table, how we defined it. So they wanted changes in law enforcement, but it meant different things, not only security, it's not more cops. What it meant was more law enforcement that represents people in those communities, people that they could relate to, and truly impact the community and provide support, and not necessarily more policing. We also spoke about education. We also spoke about community safety and what that means. And that could mean, having housing, having, being able to meet your basic needs. We also spoke that we'd like to see more trainings in the workforce that can build on the skills of the immigrants, the skills that they have and the gifts that they have, so they can go into the work field, and it might not be in their career, but if we're able to build it and we're able to train them, maybe they can go in their field, not necessarily where they're at, but we can get them to a certain level.
And as we think about this demographic shift that's occurring, the increase in poverty that is occurring all across the region, but when we particularly look outside of the city limits of Austin, there were several sort of hot button or important issues that rose to the top as needing to be addressed. In our areas, we're seeing much more complex cases that show up to our service providers' offices, okay? People who have not just a housing issue that needs to be resolved, but a food security issue, a transportation issue, an education issue, a health issue that needs to be resolved. So the cases are much, much more complex. And clearly, with that complexity, there's a need, an attendant need for collaboration. So one of the things that we talked about kind of at length was how we could better catalog and communicate with each other as service providers on what's available, and then collaborate to help solve those complex issues. So that was one. Another issue, and this is kind of an interesting one, we're starting to see more people with different languages other than Spanish who are showing up into service providers' offices, and being able to bridge a gap for those folks, somebody that shows up speaking Russian or Hindi or some other language, is a significant challenge, being able to articulate to them, to communicate to them what services are available and how to take advantage of them should they be eligible for them. So that's a big issue. Another thing that we talked about was employer engagement. Employers are actually an important part of the whole service continuum. And being able to engage those employers and get them to participate with the service providers in providing those services is an important piece. And so we need to be thinking deeply about how we actually engage employers in this process, beyond a discussion with, well, what are your training needs? What are the skills needs that you need in your organization? How do we engage you as a partner to be a foundation piece for these individuals as they're accessing some of these other services? It's critical. And then the last area we talked about was really education related, and identifying ways to make education more accessible, more affordable, okay? But the big bugaboo in the room, the thing that we all have to deal with, is driving desire, aspiration to do more. And so we talked a little bit about how some of those things may happen. And so just a couple of final notes. With respect to dealing with complex issues and all of these other things, how do we all together figure out how to improve our case management process, right? How do we do that? How do we help individuals establish a plan for themselves? And then how do we help those individuals execute against that plan? And then the last piece, we need to find ways to engage our policymakers in this entire process. If we're talking about education, the lack of student financial aid for short-term training programs is a huge barrier. Not everyone is going to be eligible for WIA. Not everyone is going to be eligible for one of the other programs that Al and Alan have through Capital Area and Rural Capital Area. Engaging these individuals and finding ways to connect them with financial aid that gets them through a program is going to be huge and transformative in this area. So we have to deal with that as well. So that's what we talked about. Thank you.
When we talked about implications of our community's changing demographics, it was pretty dire. The situation's only going to get worse. You see 140 people a day are moving to Austin. The gaps, for minorities and from east to west across Austin, all of the changes that are going on, without a concerted effort, those things aren't going to change. All of our organizations have a little piece of the pie, and what we talked about in our group is ways to have more collaborations. Hector came up with a really great idea about area SWAT teams. In those areas where individuals need services, they don't need to be sent from one organization to another organization to another organization. They need to be able to come into one facility and get the services that they need. Another idea that's a little different from what one of the other groups came up with is maybe more formalized relationships, MOUs between organizations. I've been at Capital Idea for 15 years, and I can guarantee you, just about every other time I need to call an organization, my contact person changes. That makes it very difficult, first of all, to develop relationships but also to get things done. If I know I can pick up the phone and call Chandra Tarver, I know we can get things done. But the new person doesn't know me from Adam. So some sort of MOUs or agreements probably be more beneficial. I'm a little partial to my group. Everybody in here is people we work with, so I thought we were the best group by far. Some of the other ideas, transportation. It's not like it's going to get better. We thought, trying to think out of the box, maybe there's an organization or small business opportunity for someone to create a transportation service. We have people who need jobs. We have people who need transportation or have transportation needs. Maybe putting those two together, being able to come up with a way to get elderly citizens to doctor's appointments and people to jobs. I know there's CARTS and Cap Metro, but it's not cutting it for any of us. So maybe another way, a fresh pair of eyes, entrepreneurial opportunity, something like that. Let me make sure I covered all the big points. More talk about one-stop mentality. Our group feels like if we know what's available, and Alan hit on it earlier, you don't know what you don't know. If there were a centralized resource base that we could access, that would make it much easier. You may not necessarily have to know an individual, but if you know what Capital Idea can do, if you know what these other organizations can do, you can plug into those directly. And you guys think I missed anything?
With that group, we had a lot of different ways to look at small business and how it's being impacted and how it can have an impact on this community. Some of the things that people said, people are actively looking for ways to take care of themselves, to become independent and to become self-sufficient. And so as we look at small business in the Central Texas region, not just Austin, because we talked about areas outside of Austin, we talked about it's not just an issue of being an entrepreneur, but also education and starting education early, looking at specific focused skill sets for this particular region and focusing on those skill sets, getting individuals or youth to understand at an early age the opportunities for business and jobs that are available in our community. That was a pretty extensive discussion of our particular team. So it's really about starting early, educating. Then we also talked about the age divide and educating individuals, one at a young age, but also at a retirement age or a senior age, because now people are finding it more comfortable in our area to quit a job and become an entrepreneur, because the ability to take care of yourself or to be able to expand your businesses is probably more likely now. We also talked about cooperatives and how businesses can join or individuals can join together to invest in a business financially, but also from skill sets. So you might have a lower skill set that, say, may not have a substantial or a high salary, paying salary. But if these individuals come together to create a business, and the business has the investment of each employee, that then they can be, become more wealthier in that business. And we have individuals here that can talk more extensively about that on our table, if you want to understand that more. A couple other things we talked about, the growth in the suburban areas of lower income and minority populations, and how small business, one, can help keep them in Austin, in the communities, that they should be able to share in the economic wealth and growth of the communities. And so that was, staying local and helping the people stay in their homes, as they create these businesses is very, very important. Training community representatives. One of the things as we changed to our new council and how it's split up in 10 different areas. How can we look at setting up maybe substations or like our legislators who have their offices in their community, or resource centers in those community that actually allow everyone to understand what particular opportunities may be available, and especially maybe even setting up small business committees for each of those particular regions. We also talked, is my time up?
Yeah, last one.
Oh, okay. And then one of the things we just talked about, difference in cultures and what they expect or what they're seeing as from the chamber's perspectives. And say, for instance, the Asian community sees a lot of their members are professionals and maybe not so many small business owners that are on the ground, but those that are coming here, those are the ones that are struggling. How do we help those particular businesses? On the backside, we see an African-American community with their professionals leaving the communities, and therefore, how do we keep those individuals in the community for business? And then in the Hispanic community, how we're looking at education of younger individuals into entrepreneurship is very important.
And there are a lot of barriers for single mothers with small children. Of course, affordable housing is a huge one, so we talked a lot about that. High quality and affordable childcare is a huge one. Not enough integrated behavioral health care options. And just like everybody else mentioned, not enough collaboration with different service providers. So the access to quality and affordable childcare was a big one in terms of location, capacity, who gets priority. It's been mentioned a lot of times that with the affordable housing being outside of Austin, childcare is not readily available in those areas a lot of times. With the integrated behavioral health care, a lot of times low-income families are going to be dealing with mental health, substance abuse issues, and then of course primary care needs as well. And the integration of all those produces the best outcomes and is most effective, and there just isn't enough of that. We talked a lot about how there needs to be more industry commitment to providing childcare at work. That eliminates a lot of the barriers for especially single moms who might not have reliable childcare. If they can bring their child to work and there's childcare there, that is huge. Also, something that is kind of unique to Jeremiah program, we do offer personal empowerment training classes and life skills development classes. So that's kind of talking about those soft skills that will keep someone employed once they get a job.
Some of the changing demographics that we spoke about, one was women, and how a lot of the returning women veterans are also single moms, so they need to connect with your table and the issues involved there. Some of the other obstacles of deployment with the veterans deal with translation of the military skills, being able to convert those into civilian skills and put those on the resume to get the jobs. There's also obstacles for in the education. Well, there's a lot of stuff that involvement with the GI Bill. In terms of the talk that was done earlier with the trends of the job fields and the degrees, there could be a lot more done in making sure that veterans use their GI Bill efficiently to put them into the higher paying job fields. And some of the veterans might also find that they maybe had a military specific job, so they have many years of good job experience, but when they come back, there isn't another similar job, so they have to change field and use their GI Bill to do that. And then again, that obstacle is the translation of those skills. Another growing trend.
Part of the problems that we're seeing out in the community is the lack of skills that the individuals are having once they are released. So we are trying to see how we can go ahead and implement them and get them more educated, more trained. And another problem that we're seeing is that the individuals that are incarcerated, when they receive on-the-job training, part of that problem is that they can't use it when they come out due to their offense. Another problem we talked about are employers not understanding how to read a criminal background. I'm with Ron, I'm with ACC about we need a one-stop shop. A lot of these individuals get frustrated because they're having to go through so many hoops just to get to point A. It's very frustrating for them. I commend Ms. Gonzalez over here who does job fairs. Job fairs are very, very hard to do every single month, and she has a lot of people that attend that job fairs. There's a lot of resources that are available out into the community for people who have a criminal background. The problem is that they don't either want to choose to do that or they don't know how to. Public transportation was a main problem that we were also talking about. We have individuals that if they want to work, they would take every means to get to that job. Public transportation is an in thing now. Now if you have a car, you're messing up the ozone layer. So on Band-the-Box on 2008, over 200 people were hired within Travis County, and those who had backgrounds.
So you're homeless. If you're living in the streets, the last thing you can worry about is training. So one of those things worried about was housing for the youth. And if you're making minimum wage, even then you still probably won't be able to afford some of this new housing. So that's one of the problems we saw. And one of the things we were talking about is the real estate. So like, where's your civil engagement? Anybody in here has any kind of input into that? Civil engagement? Yeah. I mean, yeah, there's a lot of like development and new buildings being made, but how many of those are accessible people with backgrounds? Yeah, 7-year background check right there, so automatically you're disqualified. Affordable housing outside of the city limits. Oh, there's no transportation out there. So the training is available for the youth, and if you're a youth, more than likely you're going to get a minimum wage job. What are the chances of you getting your own self-sufficient apartment? So that was one of the things we discussed about, and the other thing was working on we have like a Workforce One program, which is a job readiness program. The big thing that we focus is we know there's like training available for the youth. They can go to a lot of UL providers and get those kind of skills. But one thing they don't have is the social emotional maturity to actually follow through with these things. They can enroll at ACC within like the first 4 weeks, most of them drop out because they don't have the skill sets to commit to this, balance their life and to school and getting a housing. So more programs like that would be something that would be beneficial. I know like Jeremiah House was mentioning that, and some training for that. That's pretty much it.
Thank you.
Some of the things we talked about were the fact that there are a number of people that are moving to the city of Austin. However, the affordability of housing does become a factor in the cost of living for those individuals. To remain in Austin becomes a factor, and so we feel like there may be some opportunities there to assist those individuals. We also talked about making sure that those individuals that are near poverty or in poverty are aware of their economic outlook. We don't know that many of the individuals that are in the situation realize that they are or what they need to do in order to get out of that situation and what they need in order to become sustainable or become self-sufficient. So either we can create a campaign as a city to talk to those individuals. I know that many of us do individual employment plans and address those things within the employment plans. However, we don't know that there's a realistic picture or outlook that they can look at and determine where they need to be and what they need to do to get there. Also ensuring that, because we did have a lot of temporary agencies at our table, we did talk about how individuals sometimes don't know the value of temporary employment because there are a lot of times stigmas attached with having temporary employment that they don't realize that it could lead to long-term employment.
There were some trend concerns that we identified, and that was that many of the jobs that are being touted as where we need to put resources are in the high-skilled sectors, and yet many out-of-school youth and students are just not ready for that level of training yet, and we have to be able to address that skills gap that it's going to take, and the time factor, and having some sense of reality of what it's going to take to get someone, one, ready with the basic skills to get to that point and to get the jobs that they need now to take care of their families as they move towards this longer skill training that's going to be necessary to take them to that next level. But we have to have some reality-based and some transition funding that helps provide those sort of interim level trainings. So yeah, if you're busy working, you're not busy training. And those 2.8 jobs is a challenge to that. So one model that has been very effective in this is an earn while you learn model, and that's one of the things that we're doing at American Youth Works, but it's a really important way to get people accomplishing both goals at the same time. And there were, so again, in this concern area was there are many RN jobs available, and yet there are no slots left at ACC with an extensive wait list for that kind of a training program. So just trying to continually look at those sectors. There is a need for certifications and career training and work experience, such as internships, that kind of meet that in-between gap of being out of school and soft skills being a need. You get a lot of that on the job training, especially if you can have some support services wrapped around that. Okay.
When we talk about disabilities, it's very varied. Some are visible, some are non-visible, physical, mental, and emotional. And I'm going to go through this really quickly because a lot of what we wrote down and discussed has already been mentioned. But we talked about being more creative when we work with people with disabilities and approach employers about employment. We talked about, we also mentioned paid internships that DBS has experience with, OJTs that DARS does, as well as looking at our consumers and determining if they can do all of a job or pieces of a job, and then talking to employers about the possibility of job carving. So in other words, looking at people kind of individually as well. We also talked about when we go to an employer, focusing on our strengths as being disability experts and how we can help the employers in terms of diversity training, because so many of them are scared to hire people with disabilities because they have no idea what that really means, what happens if somebody's mentally ill and they start to have problems. They're also afraid of the cost of a reasonable accommodation, which most of the time is either at no cost or a very minimal cost. So we can help them with that. Let's see. Something we encounter frequently is many of our consumers receive Social Security benefits for disabilities, SSI or SSDI, and our staff at DARS has become more knowledgeable and trained on work incentives and how to talk with the consumers early on before we even put them to work. This is what employment will look like, how to report your benefits, how to look up how much you can earn while working, so we can discuss that very, very early on, because a lot of people can work and get benefits. And I think that's about.
Right now, Central Texas is the second fastest growing in the U.S. for people ages 55 to 64. A lot of those individuals are looking at life changes, or they're starting to retire, but they're needing to supplement their Social Security. So we know that there's a real need for some job-specific training for seniors. The nice thing about this population is they're bringing the soft skills and the communication skills that we so badly need, but they may not have the technology skills. So that's going to be a big piece to that. The next big problem is paid caregivers, personal attendants. Direct care service workers are the fastest growing job in the nation. They're anticipated to be hitting the 1 million mark in the next 10 to 15 years. They are also the lowest paid in the nation. They have no health insurance, and job rate turnovers are 72%. So we need to be looking at how we are supporting this workforce in the places that they work until we can make the policy changes necessary to get their salaries up, to increase their skills training, to make them be certified, to have all those pieces in place. We have to provide the wraparound support services to make sure that they can live on minimum wage. And many of these individuals are going to be dropped below the 30-hour-a-week threshold very soon. There are 160 home care agencies in Austin, majority of which are not going to be giving over 30 hours because they don't want to insure them with Obamacare. So you're going to be looking at them needing supplementary jobs, more training, helping them to move on. The third major area around working with the elderly is that 1 in 4 employees are actually family caregivers. So they're caring for a senior in their home. So we have to look at not only child care supports, but elder care supports so that these individuals can go to work. Caregivers have higher rates of illness, they have higher rates of time off, and very often are quitting their jobs in order to stay home with a senior, which impacts the whole family system. So those are the